So we're going to talk about the hip joint. And before we do, we're going to be talking about hip joint anatomy. And so the hip joint consists of the head of the femur, which I'll be showing you this in a minute, so if you don't know. But the femur is basically the thigh bone. And at the top of the thigh bone, it makes a round ball. And that round ball goes into a hole in the pelvis, which we call the acetabulum. I should say it's a hole. It's like a depression in the pelvis, which we call the acetabulum. Okay, when the pelvis is made up of two bones called the os coxae bone, and the os coxae bone is made up of three bones. So we're going to be looking at this in just a minute. The os coxae is made up of the ilium, the pubic bone, or in this case pubis, and the ischium bone. And like I said, we're going to be looking at these in just a minute. It's a ball and socket joint, just like the shoulder was. So because it's a ball and socket joint, it means there's a lot of motion that can take place in the hip joint. If you think about it, think of all the motions you can do with your shoulder. You can do all those motions with your hip joint too. So you can do flexion, extension, adduction, abduction, medial rotation, external rotation, and I should have circumduction on here too. You can also do circumduction with the hip joint. So let's take a look. And as you see here, this whole thing here, all of this right here would make up the os coxae bone. All of this in here. So you see you have one over here and we have one over here. This here is called your sacrum. That's going to make up part of the pelvis, but we're more interested in the hip joint right now. So in the os coxae, like we said, it's made up of the ilium. So here's the ilium right here. Then you have, basically, if I were to draw a line, roughly, if I were to draw a line like this would be the pubic bone that's over here. And this would be what we call the ischium. I'm going to also draw this line going this way. And this would be the ischium that's right in here. Okay, and we're going to look at this. Now, if we look, you'll also notice that over in here, we have, one second, let me get my pen again. So over in here, you'll notice we have a round circle. This is a depression. I know it looks flat here, but this actually goes in like this. And it's called the acetabulum. Okay, so what's going to happen with the acetabulum is, like I said, you're going to have the femur. I'm going to show you pictures of this. This would be the femur coming up, and then the femur is going to have the greater trochanter. If you wonder what the greater trochanter is, if you hit that bone at the side of your hip, that would be the greater trochanter that you're hitting. Okay, and I can't draw, especially when I'm trying to draw something on a mouse pad. But this would be the head of the femur. So the femur is going to insert into this. And that's going to be making up my hip joint. So it's going to be the head of the femur and the acetabulum. But we're going to look at this some more. But before we do, what I want you to realize on the next slide, what we're going to be doing is we're going to be looking at this from, I think we're over here, from this angle. So imagine I take this bone off here. I take it off and I turn it. So now this part, I'm going to turn it so this part is facing towards you, the acetabulum. So you're going to be looking down into the acetabulum. So let's go ahead and take a look. Okay, and if we take a look now, we're looking at the acetabulum. So this is a depression right here. And it's kind of deep. This is kind of deep. But anyways, to give you an idea, this bone right here, what we call the ischial tuberosity, this is what you sit on. That's the bone you sit on. If you were to feel the top of your hips, what you're feeling is the top right here. When you feel the top of your pelvis, you're feeling that part right there. Okay, so this is the acetabulum. Like I said, it's an indentation. And what's going to happen is the head of the femur is going to fit right in here. So let's take another look. So if we look at now, once again, we have the outside of the acetabulum. And again, this is an indentation here. So it's like a little crater. It has a labrum that goes around it too, just like the shoulder joint did, to help hold the head of the femur in there. So this is the head of the femur. that's right here. And this was the greater trochanter, like I was saying before. This is the part if you hit the side of your hip that you can feel. And then you have a little ligament here that goes right into the it goes right into the acetabulum to help hold the femur in there. So you can see it's helps hold it in there. And then you're gonna have ligaments that surround this whole thing. But that's just to give you an idea of how it fits in. Obviously, right now, this is not how it works. This picture is just to show you the acetabulum and the relationship between the head and the femur. Imagine you take this and swing it around and put the head right into there. And that's the way that it fits in there. We're going to look at that now in just a second. And so now you can see what it looks like once the head of the femur is inside the acetabulum. So the acetabulum goes in like this, and the head of the femur is going to come in all the way like this. You can't see the whole thing here, right? But this is going to be like this. And then you're going to have that ligament that's holding in there. And then you can see there's, you're actually going to have a labrum that goes around this. The labrum, remember, is just the ligament that's kind of like going to just hold this in place. And then you have a whole bunch of other ligaments that are going to hold the hip joint in place also. To give you an idea of what we're looking at, again, this is the part you sit on. This is called the ischial tuberosity. This would be your pubic bone. So if you think about where your pubic hair is, this is your pubic bone. So obviously you're looking at this person from the front. If you feel some just to the left of your belly button and down, not just to the left, but over about the level of your belly button and over to the left, you can feel this bump right here. Okay, so this is what you're looking at right now is as if you're looking at somebody. So that's it basically for the hip joint.